Hi everyone, welcome. I'm Felice Carullo. I'm a naturopathic doctor and currently manage the clinical information team at Metagenics. I'm delighted to be hosting the discussion this evening on premenstrual syndrome. This is a common experience of women of childbearing age. Approximately 3 in every 4 women will have some kind of symptomology associated with PMS. That could be before their cycle or during their cycle. And oftentimes, symptoms can range from fatigue to mental, emotional, depression, anxiety, and for some, it could be even more debilitating. This could be something like intrusive thoughts. This evening, I'm going to be joined by Dr. Felice Gersh. So we should let her come on and meet with all of you. We have a little bit of technical difficulty, but it looks like here she comes. So Dr. Felice Gersh, she's going to share a ton of valuable nuggets with you this evening. She's a wealth of knowledge. Hi, Dr. Gersh.
Hi. Hi.
She's an award-winning integrative gynecologist. I'm just telling everyone all about you and how fabulous you are. She has special expertise in women's health, especially hormones, and how environmental toxins, nutrition, and medications can impact women's health overall. She's a graduate of Princeton University and the University of Southern California School of Medicine. She's a prolific lecturer. She's a best-selling author. And I always tell everyone, after you have a conversation with her, she is going to be your biggest health advocate, integrative health advocate. So welcome, Dr. Gersh. Thank you so much for being here.
Well, it's a pleasure to join you. And one topic that is of essential importance to every reproductive aged female, the one that we're going to deal with today.
Yes, and being that it's Women's Health Month, it just makes sense to be talking about PMS this evening. And I think we should just jump in because a lot of women are suffering. I see a ton of joiners as we speak. Hopefully it's people that could really use this information because a lot of people just aren't aware of what integrative or alternative medicine could do for PMS and that it's efficacious as well. And so, Dr. Gersh, why is this happening to women every month during their cycle? Why is their cycle just having a profound effect on their quality of life overall?
Well, I think that what you just said about quality of life is such a critical thing because every single reproductive aged woman who is not suppressive therapy for her cycles is going to have cycles. It's pretty much the essence of being a reproductive age female. And sad to say, and nobody is keeping like perfect statistics on this, so there's a lot of guesswork that goes into this, but somewhere like 80 to 90% of women who are having cycles will have at least one or several of the different types of manifestations that can compose PMS or premenstrual syndrome. And it is really critically important to recognize that of this vast majority of women who have some degree of symptoms, that at least half of them have really substantial symptoms, and about 3 to 5% may have truly disabling symptoms that cross the line into a psychiatric condition called PMD, premenstrual dysphoric disorder, which actually is a category of psychiatric disease. So this is not a small thing. It's not a small matter. And the conventional world does have some treatments, but for the typical woman, it's a bit over the top to have to use pharmaceuticals when this is a problem involving every single cycle. So as a kind of understanding of like, what are the symptoms? Now, first of all, when you say syndrome, PMS is a syndrome, right there, you know, it's going to be a variety of different types of manifestations to a very, very woman. And something is labeled a syndrome, no one knows exactly why it's happening. And there are some theories, but no one knows 100%. It may not be identical in every woman, but we do know that there are certain very, very powerful contributing forces that can, if not initiate the problem, certainly aggravate the problem. And if we can bring every woman who has it down to a degree of manifestation that is so mild that it really doesn't interfere with her life, then that is also very successful. In terms of what it is, well, it has to do with the time frame in a menstrual cycle that occurs after ovulation. And if you have a standard, we'll say perfect day cycle, not every woman does, there's variations in that. But if you have like the textbook 28-day cycle, you would ovulate, and then the second part of that cycle is called the luteal phase. When you talk about the ovary, when you talk about the uterine lining, it's called the secretory. So if you see secretory or luteal phase of menstrual cycle, they are the same. One is talking about it from the ovarian perspective, the other from the uterine lining perspective. So this is the second half, and that is the time frame when PMS would be occurring. In fact, if you're having symptoms, and we'll go over what they could be including, if you're having symptoms that are in the earlier part, then it's just something else, because premenstrual is talking about the time before the period, and it could be up to the whole 2 weeks. For most women, it would be the prior 1 week before the period starts, and it can continue a few days into the period. But if it continues much more than 4 days after the period starts, then you got to rethink, is this really PMS, or is it PMS? And you have this problem that occurs really precisely during the luteal phase and then ends with the period. What are you going to think? It probably has something to do with the hormones, right? You know, because it does have something to do with the hormones. It's during that time of the cycle. So we want to think about, well, what could be going on with the hormones? But I thought maybe we would pause for a second and go over the symptoms. What do you
Yeah,
think? So that
I
people know
think
like
so.
what
Let us
syndrome.
know, maybe what do you see the most common symptoms for women? And then you have all the, you're even taking the questions out. You know exactly what I'm going to ask you. I think we should go over symptoms for sure.
Well, there's, I deal with this problem so often. It's such a common problem that I guess I've been asked every question in my office many times, and it's just not addressed enough by the conventional medical world, and not always really well. And because it's such a grab bag of symptoms as a syndrome, so it has to do with hormones. We'll come back to that. In terms of the symptoms, they can be, like I said, the whole spectrum, from incredibly severe and disabling to, you know, just a minor annoyance that you can almost ignore. So the spectrum of severity is very great. And we want to bring it down so that any woman who has it, we can get rid of them. But if we can't, at least bring it down to a very marginal kind of a deal. So it encompasses many different organ systems. So the brain, of course, that's a very big one. So women can often have irritability, depression, crying, anxiety, mood swings. So some women, in terms of the irritability, I call it road rage without the road. You know, like they go home and bite all their family members' heads off, you know, and then they feel terrible. It's like, why did I just yell at my kid, or why was I mean to my husband, you know? And then they have regret, and but they just can't seem to control it. Some women will, like I might cry at, you know, like a Hallmark movie, but like they'll cry at every thing, and they think, like, I can't like look like an executive at work. I'm like crying in the meeting, you know. So it can be like really disruptive to your career if you have that kind of thing.
Right.
And so brain fog, so mood and cognition are very interconnected. So women will say, I can't remember, like I can't focus, you know, my brain is foggy during that time. Well, that's not very good for anything either. And then there's a lot of GI symptoms. So everybody now hopefully is aware of the gut-brain connection. It's really powerful. And most people aren't aware of the gut-brain hormone connection, but that's really powerful too. Microbiome. So that's a very big deal. If you don't have the right microbial population, then you're going to have a lot of GI symptoms. So a lot of women will have constipation and bloating and gas and just sort of maldigestion, like they don't really feel right. And then breast tenderness. Some women will have really bad breast tenderness, and may trigger migraines, like if they're prone to headaches or menstrual migraines, that may be a trigger to it. And cramps. Women will have pretty significant cramps preceding and during the period, and that can also be part of it. So, you can see that it's a very wide spectrum of symptoms that, can be crossing the line into really disrupting quality of life, very, very.
For sure. I think we chatted about that at IHS, you and I as well, just even the anatomy of women, right? And how in the pelvis area, the GI tract sitting right there, like on top of the reproductive organs, and how for sure, if, individuals don't feel that there's a connection, then we need to be, again, going back to structure function. There's so much interconnection with the GI super system. So Dr. Gersh, would you find, well, obviously you already mentioned there's quite a few contributing factors that could alter or throw a woman off. Would you find that individuals that have more debilitating symptoms would have more contributing factors, or can you talk about that a little bit?
Yeah, absolutely. We live in a society where food is sometimes, I think, really strange. Like, I don't know who thought it was a good idea to manufacture food, to create ultra processed food, to put lots of high fructose corn syrup into many products. It has shown that women who eat what we often call the SAD diet, the standard American diet, that's really primarily filled with additives, chemicals, ultra processed food. And it's not just what's in it, it's what is left out of it. All the optimal fiber foods, the foods that feed the gut and nurture the gut microbiome, which is so critically important for everything in the body, now we know. And as well, the micronutrients, the various minerals like magnesium and calcium, which are used as part of the treatment protocol. But many women don't eat foods that have the best sources. Like, the best source of calcium is actually green leafy vegetables. And most people think it's dairy, but it actually isn't, because that dairy calcium is not going to be released to actually go into better places in the body than sitting in the GI tract or getting into the bloodstream and then possibly landing in the kidney and creating kidney stones. So the best sources of calcium are eating green leafy vegetables, and almost everyone seems to be deficient to some degree of magnesium, which is like over 700 reactions in the body, including many that involve making neurotransmitters and also helping with sleep and anxiety. And there is now understood, at least belief, because we don't know 100%, that there is something that's happening with the hormones during the luteal phase when you have higher progesterone, and you tend to have higher estrogen, but progesterone downregulates. All these different hormones have a lot of interconnection with our neurotransmitters and the production and function of neurotransmitters. And we know that the serotonin, which is like the happy feel-good neurotransmitter, may not be being produced adequately. The effects involving dopamine as well, and the neurological system of the body that involves stress, called the autonomic nervous system, is very, very heavily dependent on these female sex hormones that I always call life hormones now, but they're very, very dependent on having a proper neurological system with the autonomic nervous system. And what happens is women who have more PMS are more sympathetic or more in a stress state, and less the parasympathetic, or what we call vagal tone, a calming state. So magnesium is a very big one for that. So the lack of adequate nutrients, also antioxidants like vitamin E and vitamin D, are often in insufficient quantities in a typical American diet that doesn't include enough fresh produce, vegetables, legumes, fruits and so on, even like whole grains, which have a lot of the B vitamins, which are really important for mood. Like, for example, vitamin B6 is one of the insufficiencies that often occurs, and giving extra B6 can often be very beneficial. So replacing the nutrients that are deficient is really important, and taking the nutrients either as individuals or with a really high quality multivitamin, multi-mineral supplement can be really amazingly beneficial. And healthy fats are often insufficient. And we know that fats are very involved in our signaling systems that keep our brain happy, like omega-3 is often insufficient, and that's really important for anti-inflammatory processes in the body. So omega-3 can be really beneficial as well. And then there's what I call, in terms of salt. Like, some people eat too much salt, and salt can cause a lot of tension. Some women have like edema or swelling also during this time. Too much caffeine, too much alcohol can also be contributing factors. And just having a sedentary lifestyle, not getting enough sunlight. I call sunlight the happy medicine, because we have receptors in our eyes, and serotonin is made actually in certain neurons that are connected to the light receptors in our eye, and it sends a signal to those neurons to make more serotonin so people feel happier. So just out and getting a walk, some physical activity, because exercise is really amazingly beneficial for mood and for gut health. So getting more physically active, getting sunlight, and then from serotonin comes melatonin. And a lot of women during the time of PMS will have sleep disturbances as well. They can't get a good night's sleep. They feel really fatigued. So that can be really beneficial, because you get more serotonin, and then you make more melatonin, you get a refreshing sleep, and you feel, happy and ready to meet the day. And then we can also look at treatment. So replenishing some of these missing micronutrients, like I mentioned again, like magnesium, and some of the antioxidants like vitamin E and vitamin D, the healthy fats like the omega-3. And another oil that is often used is primrose oil, which is actually an omega-6, but it's very anti-inflammatory. So that's often used as one of the therapies, because sometimes people aren't getting enough healthy omega-6s. Everyone thinks they have too much, but sometimes they're not, because omega-6s are also the precursors to the endocannabinoids, which are lipid signaling agents that can be pro or anti-inflammatory depending on the situation. But they can also be very calming. They have receptors in the brain, they have receptors in the gut, and that can also be really helpful when you get some added healthy omega-6s like primrose oil. And then we have what I call green medicine. So have you heard, I know you're very familiar with chaste tree or chaste tree berry.
Yes, that's a good one. And we get a lot of questions regarding that at Metagenics, the clinical team, about how that works, right? Because I think that oftentimes, first and foremost, we see a lot of supplements surrounding estrogen metabolism and supporting that. But how would chaste berry help patients here?
Well, interestingly, chaste tree berry is probably the most studied of all what I call, the herbal, because chaste tree is actually a plant. Okay, so but people wonder, like, it's not manufactured in a chemical plant or something. This is a natural product. So I call it green medicine. Like, some of the treatments that are used in conventional medicine, and sometimes they're necessary for someone who has like PMDD, the severity of which can cross the line into a psychiatric illness. And that could be using serotonin reuptake drugs like Prozac, those type of things, and all the different SSRIs. Okay, so those are used in terms of like the more severe ones. Birth control pills are also used. So the idea behind that is, well, if you can't fix the menstrual cycle and the hormones, we'll just get rid of it. And I mean, it's true that for some people it works, but those of us in functional medicine, if we we would rather fix the problem at its root cause rather than try to eliminate the entire menstrual cycle and replace it with chemical created compounds that are not human hormones. But in severe cases, you have to do what you have to do with pharmaceuticals. But in terms of what we can do with like chaste tree, it's like amazing. There's been a lot of research, especially in Germany, but elsewhere, and there's published data on it. Now, in terms of the mechanism, we still don't know 100% what the mechanism is. There have been some studies that have measured progesterone levels and found a high amount of progesterone, but we're not really clear that that's even the actual mechanism for improvement. When women are given like bioidentical progesterone, some may have improvement, some may not. Some actually do better if they get estrogen in the form of estradiol as, say, a cream, a gel, or a patch, and they can do better. So it's not 100% the same. That's what you get when you have a syndrome, but you get a very high response. So some of the other theories with chaste tree is that it may affect other types of neurotransmitters, like it may actually directly impact on serotonin or dopamine and actually have a relationship. It may have a relationship with prolactin, a different hormone that some people think is maybe in too high an amount in women who have PMS. So the mechanism is still being researched, but we know it has been shown in some cases, it can increase progesterone, and it may have an impact on the autonomic nervous system, on different neurotransmitters like serotonin and dopamine in a very good way, and maybe also on prolactin. It's extremely safe. That's like wonderful about it. Rarely, like anything you swallow, somebody's going to have a GI issue, but it's like I have used this. I call it my green medicine, part of my herbal formulary. I have used it umpteen times. I can't, countless times, and I can't think of anyone that's actually had a side effect. Somebody out there is having some side effect to everything that exists in the world, right? But I have not seen any problems. And it's so simple, it's so safe, with really excellent benefit and results. And so it's really something that every woman with PMS should try. It's really, really important to have like a whole array of solutions, because since it's a syndrome, you're going to have different causations to some degree, you're going to have different severities, but there are certain things that I consider foundational. One is, that you increase the intake of all of the healthy fats, micronutrients, and really eliminate the processed food and the bad fats and the ultra foods that have all the high fructose corn syrup and so on. So you get those out. You get rid of the caffeine, you get rid of the alcohol, you work on sleep hygiene and exercise, you work on sunlight, and you do another thing that is so important is to add in some form of mind-body medicine, because there really is a dysregulation of the autonomic nervous system. Like if you want to look up something trending now, it's the autonomic nervous system.
For sure.
And as a general statement, have too much sympathetic or the stressor part and not enough of the vagal tone, the calming part. And it turns out that the vital hormones made by the ovaries are majorly important in modulating or helping to regulate the autonomic nervous system. And some women become even more prone to the sympathetic, the more stressed part. That's why mind-body medicine is so important, whether it's guided meditation or having massage therapy, using certain essential oils. And part of that is using, in my opinion, some of the adrenal adaptogens. So these are like natural medicines, green medicines from plants that can help to reduce the cortisol, which is part of the stress response, the epinephrine, norepinephrine, which gives people like palpitations. Some women get that, and that stress response that they can't relax, they feel tired, that kind of thing. And so one of my favorites is ashwagandha, but there chamomile products are wonderful, and teas are great. And holy basil or like tulsi is wonderful, so you should incorporate the teas as well. But the herbal medicines, like I say, ashwagandha should be like a staple, because it's so amazing. But then, there are other ones that can include things like passion flower and lemon balm that are naturally calming, Chinese skullcap. So these are some of the like green medicines that are naturally sort of calming. There are, other Indian combinations, like from Vedic combinations. So there are so many things that can be tried. And also love, like I mentioned briefly, massage. So if you have some that can do like craniosacral and just kind of, most people have like a lot of fascial fibrosis. So that I would say, of all the medications that are called green medicine, plant-based, the chaste tree is like the foundation. That is like foundational. That should be where you start. And then you layer in all the lifestyle approaches. And then you can add in like the relaxing teas. You can add in some of the other herbals like the adrenal adaptogens that will help also to sort of calm and bring up more of the parasympathetic or the vagal tone, like my favorite being ashwagandha. But there are others like products that contain bacopa, and like I mentioned, the relaxing ones, the lemon balm, the passion flower, and so on. So we have so many tools that very few women really need to resort to the pharmaceuticals, as long as they're not in the more ultra severe category. And we can probably reverse the symptoms and alleviate these symptoms probably 80-90%. It's really that significant, in my opinion, based on my own long established patient care.
For sure. Yeah. For those that are tuning in, that like this might be the first time they've heard of any of this integration or alternative side of things, apart from, lifestyle modification, just, everything in moderation, including moderation. Apart from that, diet, anything that brings them joy. What basic supplements do you think, if we can keep it to like 4 or 5, what would you suggest they start with? Would it be foundational health? Would you recommend anything in particular if there's more pain, a microbiome support? Where would you go with that?
Well, that what you just were saying at the end is so key, because you have this wide spectrum. And we didn't really address every single symptom that
Right.
women can have. That is true. So if we like maybe just focus on symptoms and like what would be good. So shape addresses everything. Okay. So that's like foundational. Then if someone has a primary problem of feeling anxious, and they can't sleep and maybe moody, my goodness, jump into magnesium, okay? And if they're tend to constipation, which is very common, then I would probably use magnesium in the form of citrate. Now, if they don't have any constipation, I might go with one of the, like like magnesium, why am I blanking out?
Yeah.
Citrate. That's not right. Why am I blanking out? But the not the citrate formulation, and you can use a 3. Yeah. Okay. I need more magnesium. Okay. So anyway, so we definitely want to use the magnesium as one of our mainstays. And then, there's a lot of different multivitamins that can be good. But if you want to pick out like specific nutrients, I would definitely go with a calcium. And the dose of calcium that's been looked at is the like 1200. So it's a little higher than I would normally recommend for routine. But in terms of using calcium as a treatment, now you're using calcium not just as a calcium supplement for bones, you're using it specifically for this purpose. And I would go with the 1200 milligrams. That's what has the most research for calcium. And different calcium comes in types of binders, because calcium is going to always be with something else, like a mineral, just like magnesium. You don't just buy usually plain magnesium. So you could do magnesium citrate or, rather calcium citrate or other forms of calcium, okay, that will be bound to something. And then, so that would be definite, like I would want the calcium, I would want the magnesium, and B6. So B6 another a vitamin that has been shown to be very good for the mood. So these are all the ones that are primarily the mood types. Okay. So, and then I would always add in a multivitamin, a good high quality multivitamin, multimineral, because you want to have the other antioxidants. You want to have the vitamin C, you want to have vitamin E, you want to make sure you have some vitamin D in there, because these are really, really helpful, as because inflammation is always an underlying issue in just about everything, including neuroinflammation and pain like menstrual cramps or headaches. That's always involving inflammation. So these antioxidants very good, but it's hard to take a pill of every kind of vitamin. So a good multivitamin can be really a mainstay as far as the treatment goes. And, you know, an oil of evening primrose can also be a additive. And, you know, you can add in terms of foods, you know, you can add in like walnuts and pumpkin seeds as other good sources of magnesium. So that's, you know, quite a few different supplements right there. And always add omega-3. I think you should always add in a high quality omega-3 from, you know, derived from healthy fish oil.
You're talking my language. I'm obviously a big supporter of foundational health. Anyone who's talked to me before, they know I'm going to push phytomulti. It's every human should be on phytomulti. The research supporting the DNA protection and stability with the antioxidants is second to none. So I completely agree with you there. And then just to remember that Metagenics uses microcrystal hydroxyapatite as the source of calcium. So it's bovine derived, but it's very, very close to what we would see with humans. And we're getting additional minerals, not just the calcium. And just, you know, remember that that's what the body likes, the thing that's closest to original, right? So the body can decide what it needs and what it needs to do with those nutrients. So you're talking my language for sure. I love that. Incorporate foundational health. Recently, I started using a flavonoid rapid. I don't know, have you heard of that, Dr. Gersh, at all? But it's quite equivalent to giving like acetaminophen. And so for individuals with any cramping or more pain associated with cramping, I've noticed that it's been relieving pain for a good like 3 hours at a time per capsule. So, you know, again, like that's kind of green medicine. It's just helping take away the symptomology, but sometimes we need to do that while we work on other things.
I love it. Absolutely. And that's absolutely always my philosophy, to try to give something that's most natural for the body, which of course is never a pharmaceutical, but you know, that's like third tier. Like after you do lifestyle and green medicine, then you would go to pharmaceuticals.
Yeah, absolutely. One question about, you did mention progesterone. Do you find that you need to give progesterone at all during PMS for these individuals or beforehand, or do you kind of just, that's your last resort?
Well, it's interesting with progesterone. There was some work like maybe 25 years ago, but when they actually researched that looked like it helped giving progesterone, and I'm not against it, but when they actually did more double-blinded studies, it didn't really seem to be that beneficial as a general rule. That said, it's extremely safe to give bioidentical progesterone, so it can be worth a try. But the actual double-blinded studies did not pan out as well as hoped. And so it's not as simple as you have a progesterone deficiency. In fact, if they do measurements of progesterone in women with PMS, they don't actually find that they produce less. They don't have a lowered production of it. So it may be something more complex involving the interplay receptors and other systems in the body is affecting neurotransmitter production or function. So it's more complex than you just take progesterone. I wish it was as simple as that.
I agree. Yeah. Do you have, I mean, I find that I'm seeing a lot more patients that are starting, it could be towards perimenopause as well, but antihistamines because of mast cells and a lot of inflammation. Do you have a lot of patients that take antihistamines for inflammation during PMS?
I don't. I'm very user of quercetin.
Yes.
So that's a more natural product for controlling mast cells. So mast cells are the first responders of the innate immune system. And thing that is going awry, whether you have leaky gut, if you have pain, if you have, it starts in the gut, with leaky gut, and then you have more inflammation. The first responders are going to be the mast cells, and mast cells essentially line every interface between the outside of the body and the inside. So you'll find mast cells, of course, in your skin. You're going to find mast cells in your sinuses, in your nasal cavity. You're going to find it in your bronchial tree of your lungs and throughout the GI tract, which is another interface. So whenever you have some sort of dysregulation of the immune system, or you have some other toxicity that's causing the immune system to become in a pro-inflammatory state for whatever the reason, you're going to have activation of mast cells. And if you have an allergy, it could be in your nose. So you're going to get all the congestion, runny nose. In your gut, you can have all kinds of symptoms, digestion, and that's why they have in the past were giving types of drugs like to try to control mast cells in the GI tract. So that is not an uncommon approach to give antihistamines for a variety of things to try to control the cells. But I find in most cases I can use quercetin plus avoidance of trigger foods, because often if you avoid pro-inflammatory foods and you also look at avoiding things that they clearly are allergic to, it's like the hardest thing is when you're allergic to your dog and you just keep sleeping with your dog and then you wonder why you're having problems. It's just hard to get people to sometimes abandon practices not really good for them. So, but usually if you practice avoidance of things that are triggers, and then you eat the right diet, sort of an anti-inflammatory diet, and you take things like quercetin and eat foods that have a lot of quercetin, like apples and garlic, usually you can avoid living on antihistamines because antihistamines are blocking histamine. What one had really preferred to do is not to block the results of the mast cells rupturing and releasing histamine. We'd rather stabilize the mast cells so they don't rupture at all, because histamine, like every neurotransmitter, is doing multi things, tasks in different parts of the body. And in the brain, histamine sets memories. So antihistamines long-term can affect cognitive issues. So we don't really want to take them if we don't have to. So I'm always looking for alternative natural solutions.
I agree. Immune active. So that has quercetin, N-acetylcysteine, vitamin C, zinc. We forgot to talk about zinc for PMS.
I love
Yeah. And 7 to 10
fantastic.
days. It only takes 7 to 10 days for your microbiome to be the same as your pet's microbiome if you're going to sleep beside them.
Yeah, but that is a fantastic combination. Now, zinc, like magnesium, like every important mineral, which all these micronutrients are so important. Zinc has so many different functions in the body, and it's really critically important for healing. In fact, wound clinics routinely are using high dose zinc now. So it's critically important for healing and healing of anything in the body, including the gut. And you can get zinc in different combined combinations that can be more directed at different parts of the body. And it's really another critical component of having a healthy, functional immune system. So yes, and many people are very deficient in zinc, or insufficient at least, and they're not eating a lot of foods with zinc because most foods don't have a large quantity of zinc. And the largest quantity of zinc is found in oysters. Now, I don't really see a lot of people eating oysters. So yeah, a lot of food doesn't have.
I'd rather take the zinc. Yeah.
Yeah, I take, so yeah, sometimes it's just the better part of valor to say, I'm going to take the nutrient.
So for everyone listening, we keep getting joiners, tons of joiners on and off. So it's great. They're obviously loving the information you have and your clinical expertise. Again, for those of you that are just joining, we're talking about PMS. We're actually going to wrap it up here soon because I think we're almost at time for Dr. Gersh. But we did talk about using foundational health, so multivitamin, maybe a calcium, like a bone builder supplement, supporting the microbiome with probiotics. Do you have a favorite probiotic at all?
Oh, I love blends.
Yeah.
So, of some really great data coming out about archemansia, and weight loss and
For sure.
things. And I think that recognizing that the microbiome is a collective of trillions of microbes, thousands of different species. I love combos, but in terms of if I was going to pick what's my favorite right now, probably archemansia is my #1 favorite. But there's, lactobacilli, bifidobacterium. I don't want to play too many favorites. I love combos.
I think that will be another discussion everyone will have to join in to listen to about our pasteurized Akkermansia. Just because a lot of the research I'm reading is just looking at the systemic effects on the immune system and how quickly it could decrease inflammation. We talked about, individuals using antihistamines. Natural antihistamines are best, obviously, but the use of Akkermansia being able to take down inflammation, especially with IG and mucous membrane areas, is phenomenal. So yeah, we'll definitely have to chat about that on another Instagram live. This is our first Instagram live, by the way, so we're really excited to have everyone here and join. But any last thoughts, Dr. Gersh? Just I think some people are feeling overwhelmed. I could see a few comments coming through. We talked about foundational health, just making small changes to diet, lifestyle, things that bring individuals joy, eating food, whole food, as closest to original as possible, right? There's things you could do if you don't have time to cook, right? We could use services that deliver the kits that are almost ready to be made. You just have to unpack them and make them. These are the ways we could really work towards improving your health outcomes overall. But anything else that we can leave our listeners and our viewers with?
You were saying we don't want to get it. The bottom line is how your body works is a direct reflection of how you treat it. It really is. And so if you put in the right foods and you avoid processed foods, especially what we call ultra processed foods, and we try to do like the whole foods, like you go to the farmer's market or you go to the produce section and you buy food that didn't really go through the factory, except if it went through the factory, it just got packaged. It didn't get transformed. And you look at labels, and if it has anything other than like a couple of organic ingredients and it has chemicals are not part of the food chain, just don't consume them. And so if you work on fitness and you work on stress, you have a mind-body practice of some kind that resonates with you, and you try to get in your steps every day and do some weight training. It doesn't have to be a lot. You could just be walking around that, gardening and doing things. And, you try to avoid a lot of chemical toxin exposures, so you don't use a lot of plastics, and you try to just use glass and steel for storage, and you just try to choose things that existed 200 years ago as opposed to 50 years ago. Like, you just really try to get away from the plastics. That's one of the biggest problems, and flame retardants, and just try to use natural cleaners, the best personal care products. And you just get a few, like I'll say, foundational supplements, just like we said, like the foundational, like a foundational probiotic, a multivitamin, and then, you use like food as medicine, so you can incorporate like herbal teas, and then you learn a little bit about green medicine, utilizing plants and herbal extracts that are concentrates of natural products like chaste tree, and other like ashwagandha, and then you get a few minerals like and zinc, and just those few things alone as a starting point, and you'll be 10,000 steps ahead of most every other person, and you'll feel better. Try to go to bed at a reasonable time in a cool, dark room, because sleep is so important. And I know like Metagenics has some, amazing sleep herbal combos and such, that maybe we talk about another day, because sleep is essential. And many women with PMS are having sleep problems. And there's, the adrenal adaptogens, but you don't have to learn everything about everything in one day. So the takeaway for PMS is that it's incredibly common. It's very, very treatable. Learn about chaste tree, learn about some essential nutrients and vitamins and lifestyle, and you will be in very...
Yeah, the human body is remarkable in that it wants to heal, and it's always trying to push you towards healing. So the very minimum that you do, you will already see improvement, as Dr. Gersh noted. Again, for those of you that are on, I see a lot of names I do recognize. So thanks so much for joining. If you're a practitioner, we do want to thank you so much for joining and want to offer a coupon code. It is G as in George, L as in Lima, 52215, P as in Paul. I'll pop it in the chat. I'm pretty sure it's 15% off your order. And for those of you that are just new to this whole world of alternative integrative medicine, we especially thank you for joining and taking the leap to be here this evening. Sometimes it's just hard to make small changes, but we are here trying to empower that. Like I said, Dr. Gersh is going to be your biggest advocate. You should follow her on Instagram. She has great educational videos and tools on her Instagram. She's all over the place. She's on YouTube. As a researcher myself, I love that she's always contributing to the research surrounding this, because there's not a lot of us doing that. But then also follow Metagenics. We're always going to be your educators, up-to-date research. We have Metagenics Institute, which is some great information as well. And we are going to give you a coupon code as well, GL52215. So I'll pop that in the chat. But yeah, I think that, again, if you're new to this whole integrative, alternative, wave of thinking, just give it a whirl, like Dr. Gersh said. Just try a couple products, but give them a good go, right? We want to at least give them a go for a couple months, right, Dr. Gersh? We always say about a minimum of 3 months. It doesn't always take that long to see improvement, but, give it a good go.
Oh, absolutely. Most everything, say 3 months. Absolutely. But you'll see improvement much, much sooner than that. Probably in a week. So
absolutely. Yeah. You'll have more energy, and then you'll just come back to our next Instagram Live. We have another Instagram Live next month. I believe that's on urogenital health, but again, like, hats off to Dr. Gersh. It's our first Instagram. It's on PMS, and basically we want to just promote women's health and advocate for, prevention for long-term disease states or conditions when it comes to women's health in particular. We definitely need to be talking about women's health a lot more than we are. Mm-hmm. Thank you, Dr. Gersh, so much. I know we're going to see each other again, so I can't wait till our next conversation. I think another conversation we should have next time is you hit the nail on the head for me when you talked about head and neck, craniofacial. That's my jam, so we should chat about that for sure one day. There's a lot going on in that area.
You bet.
Thanks, everyone.
Thanks for having me.
Have a great night.